Prostate cancer is a significant health topic that deserves our attention. It is one of the most common cancers affecting men globally. Understanding this disease is the first step toward managing it effectively. Many men will face a prostate cancer diagnosis in their lifetime. However, it's important to know that with early detection, the outlook is often very positive. Greater awareness leads to more men getting checked, which ultimately saves lives. This is why we need to talk about it openly and clearly. We must remove the fear and replace it with knowledge, empowering every man to take control of his health journey. The more we know, the better prepared we are to face it. So what exactly is the prostate? It is a small gland about the size of a walnut. It is part of the male reproductive system. The prostate sits just below the bladder and in front of the rectum. Its main job is to produce a fluid that mixes with sperm to create semen. This fluid is important for fertility. Although the prostate is small, it can cause big problems if it is not healthy. As men age, the prostate can grow larger, which is a common condition called benign prostatic hyperplasia, or BPH. This is not cancer, but it can cause similar symptoms, which we will discuss later. The health of your prostate is directly linked to your overall well-being. When cancer develops, it means cells in the prostate gland have started to grow out of control. Sometimes this cancer grows very slowly and may not cause serious harm. In other cases, it can be more aggressive and spread to other parts of the body. This is why it is so crucial to understand your personal risk factors. Age, family history, and ethnicity can all play a role. Being informed about these risks helps you and your doctor make better decisions about your health, including when to start screening for potential issues. Knowing these basic facts is your foundation for good prostate health. It's not just about knowing what can go wrong, it's about understanding how your body works. This knowledge empowers you to notice when something feels different. It encourages you to have important conversations with your healthcare provider. Think of it as a roadmap for your long-term health. The goal is not to create anxiety, but to build confidence. By learning about the prostate, you are taking a proactive step toward a healthier future. This is the first and most vital part of preventative medicine and personal care. One of the most important things you can do for your health is to listen to your body. Recognizing the symptoms of potential prostate issues is key to early detection. In its early stages, prostate cancer might not cause any signs at all. This is why regular checkups are so important. However, as the tumor grows, it can press on the urethra, the tube that carries urine out of the body. This pressure can lead to noticeable changes in urination. You might find yourself needing to go to the bathroom more often, especially at night. You might also have a weak or interrupted urine stream, or feel like you can't empty your bladder completely. Beyond frequent urination, there are other symptoms to watch for. Some men experience difficulty starting urination or find they need to strain to get the stream going. Pain or a burning sensation during urination can also be a red flag. Another symptom to be aware of is seeing blood in your urine or semen. While these symptoms can be caused by other non-cancerous conditions like BPH or an infection, they should never be ignored. It is always best to get them checked out by a doctor to determine the cause. Your health is too important to leave to chance. When you visit your doctor with concerns, the diagnostic process begins with a conversation. Your doctor will ask about your symptoms, your family health history, and any other relevant medical information. This is followed by a physical exam, which usually includes a digital rectal exam, or DRE. During a DRE, the doctor inserts a gloved, lubricated finger into the rectum to feel the prostate for any hard lumps or unusual shapes. This test is quick and can provide valuable initial information about the health of your gland. It is a simple but effective first step in the diagnostic journey. If the initial exam raises concerns, your doctor will likely recommend a blood test. This test measures the level of a protein called prostate-specific antigen, or PSA. PSA is produced by the prostate gland, and high levels can sometimes indicate the presence of cancer. However, high PSA can also be caused by other conditions. If your PSA level is elevated or the DRE is abnormal, the next step is often an imaging test like an MRI to get a better look at the prostate. A prostate biopsy, where small tissue samples are taken from the gland for analysis, is the only way to confirm a cancer diagnosis with certainty. Receiving a prostate cancer diagnosis can feel overwhelming, but it is important to know that there are many effective treatment options available. The right choice depends on several factors, including how aggressive the cancer is, whether it has spread, and your overall health and age. For some men with very slow-growing, low-risk cancer, the best option might be something called active surveillance. This means your doctor will monitor the cancer closely with regular PSA tests, DREs, and biopsies. No immediate treatment is given unless the cancer shows signs of growing or becoming more aggressive. This approach avoids the side effects of treatment for as long as possible. When treatment is necessary, surgery is a common option. The most frequent surgical procedure is called a radical prostatectomy, which involves removing the entire prostate gland and some of the surrounding tissue. This can often be done using minimally invasive techniques such as robotic-assisted surgery, which may lead to a faster recovery and fewer side effects. The goal of surgery is to remove all the cancer cells from the body. It is often most effective for cancer that has not spread outside the prostate. Your surgeon will discuss the potential risks and benefits with you in detail before you make a decision. Another primary treatment for prostate cancer is radiation therapy. This method uses high-energy rays, similar to X-rays, to kill cancer cells or stop them from growing. There are two main types of radiation therapy. The first is external beam radiation, where a machine outside the body directs radiation at the prostate gland. The second is brachytherapy, where tiny radioactive seeds are placed directly inside the prostate. This delivers a high dose of radiation to the tumor while minimizing damage to nearby healthy tissues. Radiation can be used as the main treatment or after surgery to eliminate any remaining cancer cells. In addition to surgery and radiation, there are other treatments available, especially for more advanced cancer. Hormone therapy, also known as androgen deprivation therapy, is one such option. This treatment works by reducing the levels of male hormones, called androgens, which fuel the growth of prostate cancer cells. Other options include chemotherapy, which uses powerful drugs to kill cancer cells throughout the body, and newer treatments like immunotherapy, which helps your own immune system fight the cancer. The best path forward is a decision you will make together with your healthcare team, tailored specifically to your situation. While there is no guaranteed way to prevent prostate cancer, there are positive steps you can take to lower your risk. A healthy lifestyle is your strongest defense. Research suggests that a diet rich in fruits, vegetables, and whole grains can be beneficial. Try to include foods like tomatoes, which contain lycopene, and cruciferous vegetables like broccoli and cauliflower. At the same time, it is wise to limit your intake of red meat and high-fat dairy products, as some studies have linked them to a higher risk. Making these simple dietary changes can have a powerful impact on your overall health, not just your prostate. Regular physical activity is another cornerstone of cancer prevention. Aim for at least 30 minutes of moderate exercise, such as brisk walking, swimming, or cycling on most days of the week. Maintaining a healthy weight is also crucial. Obesity is linked to a higher risk of developing more aggressive forms of prostate cancer. Exercise not only helps you manage your weight, but also boosts your immune system and reduces inflammation, creating an environment in your body that is less welcoming to cancer. It's a powerful tool that is entirely within your control. Small, consistent efforts can lead to significant long-term benefits. Beyond lifestyle choices, being proactive about medical checkups is essential. Talk to your doctor about when you should begin screening for prostate cancer. The conversation should typically start around age 50 for most men. However, if you have a higher risk, for example, if you are African American or have a close relative who had prostate cancer at a young age, you may need to start these conversations earlier, perhaps at age 40 or 45. This discussion will involve weighing the potential benefits and risks of screening tests like the PSA test, allowing you to make an informed decision that is right for you. Ultimately, you are the most important advocate for your own health. If you experience any of the symptoms we have discussed, or if you simply have concerns about your prostate health, please do not hesitate to speak with your doctor. Early conversations can lead to early detection, and early detection provides the widest range of treatment options and the best chance for a successful outcome. Being informed and proactive is your greatest strength. Take charge of your health today by starting a dialogue with a trusted healthcare provider. Your future self will thank you for it.